When you're off the med, you will notice a day after a feast, planned or unplanned, you will wake up the next day less hungry. It's to whatever degree your body is on rhythm or not is obviously going to affect that, but meaning healthier or not. But this is your body saying, I had a high amount of calories yesterday. And so this concept of having to wake up the day after a feast and go back into normal eating, I always laugh when I see that because that couldn't be farther from the truth. We don't have to deep fast and deep feast that intensely, but having some amount of fluctuation with our calories and not being so robotic, because nowhere in history did we ever have a diet that was, I ate my 1,800 calories every single day. Like it's never, our body was never, for millions of years, that we ever had that. Holiday eating is obviously something that is a couple things we can do, before, a couple things we can do after. And you guys have heard me talk about this, but it's always good to repeat, right? Whether it was a planned feast or not, that's another one, right? You could have some planned feasts like, hey, I'm going to enjoy this day. I think those are good. The planning a feast for yourself on a birthday or a holiday, a place that you know is going to have your favorite food, and you can plan for it. Wow, that's the best. And there's going to be times where you didn't plan for it and life just hits you hard and the stress of the situation, you gave in and you open up your eyes and all of a sudden you're 10 brownies deep. What the hell happened? You black out. That could happen too. Yeah. Okay, fine. Then we go on damage control afterwards. I think it's probably a good topic to train on in both scenarios. So if it's planned, then obviously that means you can do some prep before. And a lot of the things is just increasing your fasting, possibly and or lowering your carbohydrate intake prior to that big feast day. And then you feast, right? And then on feast day, always getting resistance training in. Like the more that you can have that window of your food be after the weight training, the less damaging to your body the high calorie, high carbohydrate, obviously processed laden meal will be, because to get a good visual of it, it's almost like your muscles are soaking it up. Man, they really are. Your muscles are vesicles for glucose, a lot of glucose. And for us getting into this program, getting into this lifestyle, what we're finally doing is we're dumping the glucose out. You start going low carb, you start fasting. All of a sudden your muscles and liver are like, holy crap, I can actually get rid of some of this stuff, right? It's for a lot of you guys, your muscles have been just full of glucose for so many years because you never did fasting or keto. We're building this ability for our bodies to become metabolically flexible and go back and forth. And so weight training and pairing up your carbs on weight training days is always a good strategy, whether it's part of your lifestyle, which it is for me, or it's part of a cheat day, high calorie day. And then finally, afterwards, you will notice, and probably you might not notice it as much when you're on the med because you're so suppressed with your appetite, but when you're off the med, you will notice a day after a feast, planned or unplanned, you will wake up the next day less hungry. It's to whatever degree your body is on rhythm or not is obviously going to affect that, but meaning healthier or not. But this is your body saying, I had a high amount of calories yesterday. I had a high amount of energy. So today's energy demands are going to be lower. And so this concept of having to wake up the day after a feast and go back into normal eating, I always laugh when I see that because that couldn't be farther from the truth. So it's easier to have a lower calorie day or even a full fast day. We don't have to deep fast and deep feast that intensely, but having some amount of fluctuation with our calories and not being so robotic, because nowhere in history did we ever have a diet that was, I ate my 1,800 calories every single day. Like it's never, our body was never, for millions of years, that we ever had that. I do believe in that concept, and I think it is very powerful. And the whole other piece of it, as a reminder there too, as well, is it gives you so much more flexibility, right? Like you can use this ability for your body to be able to feast, right, as an advantage to allow you to feast, which is nice in those settings, in those social settings. Part of a comfortable lifestyle is being able to enjoy situations, and some situations are just going to be more enjoyable when you eat. We all know that. And so we can use this to our advantage, which is also really cool. There's, for some of my veterans who have been at the FLOA protocol for more than 2 months, the FLOA fasting variability is a great video, and the need to switch things up and keep the fasting on a good every month, do a switch up, do a change in the length and the duration is very important too as well.
So I do have a quick question. I'm getting like closer to my goal weight, and I'm not so sure what my goal weight should be now. So I'm going to go get a DEXA scan because I figured that's like the best way to really figure out where I should be. One of the tests that they offer is the RMR as part of that. Do you think there's value in that for actually getting where my true caloric intake should be?
Are you going to go through Body Fat USA?
Yeah.
Yes, that's actually where I forget. See, here in Colorado, yeah.
Yeah.
I didn't get that, but it's definitely. I thought about getting it just to get it. I think it's an extra $80, something like that.
Yeah,
$90.
that's I'm like, I was gonna schedule it, and then I saw they did that, and I'm like, I'm gonna wait and ask Dr. Jones first. Is there accuracy in that part of it to dial in that caloric intake part of it as well?
Yeah, I
Since
think
we're playing around with that with me right now.
I think it could be a valuable tool. Yeah, I
Okay.
do. Even when we're not necessarily counting calories every single day, it still adds to. It's a good confirmation. Okay, great. So if I was counting 2,200, let's say, for example, so
Yeah.
I certainly think that could be a good sort of at least confirmatory tool. And if some sort of other crazy number pops in, well, that'd be interesting to see. So.
Yeah. I was just curious on like, is there accuracy in that portion of the test as well? Since I'm going to go in anyways, because like now that I'm closer to my goal weight, I'm not so sure where my goal weight should be. So I'm going to go get the test done so I can dial that in.
Yeah, and this is the goal weight, guys. You guys see me. I talk about weight so often, even though weight is such a horrible metric. I do it because it's easier to communicate. And when you're in the stage where you have lots of body fat to lose, and I know lots is a very relative term, but like I have extra body fat in my body, weight is great. And I can just use that metric of that 1 to 1.5% of body weight loss continually every single week. I can use that as a really good metric, right? Once you start getting leaner and once you start getting closer to this optimal ideal, then weight does start to become a little bit, I would say, potentially trickier to interpret. And we need to start relying on other metrics, is a better way to say. It just becomes less valuable to us. So body fat percentage has always been the gold standard. It's just extremely challenging to do. The common thing that you'll see sold everywhere works off a technology called electrical impedance. And there's so many different versions of them, some that you hold, some that you stand on. And generally they're very inaccurate. They're very inconsistent. The amount of water weight in your body really can throw that off. So any body fat measurement that just has you holding something or standing on some sort of metal surface, that's what this is. And gyms are very popular for that, for having that. Very inaccurate in most cases. Calipers can be very accurate if you had somebody who was trained in them and the same person doing them. That's obviously tricky. I do plan on creating a little course so that someone can teach their significant other, and that would be something cool. I have looked at that and I'm probably going to do that. But yeah, outside of something like that, which would still mean you have to have someone else learn that, which is not that practical, right? There's not a lot of great. And DEXA scans are really the gold standard, as well as hydrostatic weighing. Google whatever area you live in, and you might be surprised to find a DEXA or a hydrostatic weighing. This is a powerful tool. It's not cheap. How often? It's also a bit of a process, takes a little time. And depending on where you're at, I think doing these every now and then could be very powerful as you learn more and more about your body. I would say where Don's at, as you're getting closer to your goal, that if you've never done one, that would be a good time to do one, just so that we can, and then let us know if you're in my coaching programs. That information can only help me help you guys so much more. If you are going to get both DEXA and hydrostatic. Hydrostatic means like they put you in this tank and they dip you in water. I've done that too. It's pretty interesting. You just have to put a bikini on, and that DEXA scan also takes 10 minutes laying down there. So they both take about the same amount of time. They're both highly accurate. When you're in the lifestyle and you're really truthfully at your ideal goal, once a year could be, once every 6 months to a year could be an awesome thing. If you do happen to live near one of those areas, just to have a really strong, objective accountability metric. But as you guys know, I've taught you guys many other metrics outside of that. So if we are getting leaner and we are getting closer to our goals, we do have to look, since we're talking about that, other metrics of measuring our body fat. Pictures are big, and you want to use pictures as you want to, and like you're running an experiment, right? So you want to be consistent. Let's say you do them, I think don't do them any more than every 2 weeks. You could do them once every 2 to 4 weeks, I think is totally fine. And I think the three solid like angles would be front, side, and back. Stand in the same area of your house. Maybe you have a place for a tripod, you do it yourself or have someone else take them, but try to be consistent in the same lighting and be consistent on the schedule. That could be pretty powerful because you can look at that picture and be objective and say, do I see any differences? The how your clothes fitting is also a good one, as long as you're accounting for particular clothes that might be getting smaller because of the dryer. So make sure you're not getting confused there. But if you have clothes that you know are not shrinking, then the changes in how your clothes are fitting can also be a metric that your body fat percentage is changing. So these are important to consider too as well. Gold standard, meaning like what's the best I should strive for? Body fat percentage as a woman would be somewhere around 20%, and as a man would be 15. That's like the most ideal. And what I mean by that is you'll have more and more improvements in your health that could be had getting closer and closer to that body fat percentage. And also meaning that if you were to get leaner, that you probably wouldn't benefit much more health wise. And if you get too lean, it could actually work against you, especially for women having dysregulation of your cycle and decreases in hormones. But men too can have hormonal issues as well. As you've seen bodybuilders who get to those extreme levels really mess themselves up. Do you have to get that lean? Look, you guys are the ones that are, this is your life. This is your journey. My opinion is you should absolutely strive for that. You should because look, we have how many years in front of us, how many decades of life in front of us, where the goal is going to be to maintain, but let's just give ourselves a little insurance here. Let's say I do deviate. Let's say I do gain a couple percentage points. Having got to a really good state just gives you a little wiggle room, gives you a little insurance. But again, the whole goal that we're accomplishing, what we will accomplish with this is much more stability than we've ever been able to have, because this protocol focuses on those driving factors behind obesity, factoring in all the other things that can drive it too as well, which is stress and toxicity are their own things, and inflammation. But the insulin resistance piece of it, this protocol, I know is the most aggressive set of lifestyle strategies that can help you really target that. Great question. Great tangent to the side.
You've hit your weight loss goal, importance of not undereating.
So I think it's a good reminder is the importance of not undereating once you are at the stage of your fasting where you are at least 36 hours, right? So once you hit that stage where you are now officially going to bed after a full day of not eating and you're waking up the next day, you're officially in that 34-hour, 36-hour range. In that range, this is such a massive calorie deficit already that if we then follow it up the next 5 days and continue to undereat, which is what a lot of people are doing on a daily basis, we will trigger that same reaction from our body. We will trigger that same metabolic downregulation that eating a smaller amount of calories on a daily basis triggers, right? Because while it varies person to person when that plateau happens, and that is fascinating, I'm sure it's hormones and genetics, what is true across people is that you will plateau. And when you plateau from a calorie deficit is going to depend on how aggressive that calorie deficit is, AKA a full-blown fast of 0 calories in, usually for most people, somewhere between 4 to 5 days. Most people will hit a hard plateau and start experiencing some metabolic downregulation. And then if we do like more of, which in most people is that 2 to 3 to 400 calorie deficit daily, that could be anywhere from weeks to months, right? So we know that these individual differences are present between person to person, but we still take that into consideration in regards to how we, in essence, we prevent that by making sure that we're getting more calories in outside of those long days. Now, we talk about not counting, and you guys know why I'm not a fan of counting calories. So it's important that because you're on the GLP-1 med, that you really need to almost overeat. Like Hitting a full 1,800 calories may feel like overeating when you're on GLP-1s, but that's just the reality of the situation. And we do our best to try to prevent that feeling by making sure that you're not jumping to super high doses. But some of you come to us and you're already on high doses, and obviously that's problematic. Ensuring you're getting around 1,800 calories, give or take, whatever your TEE is at, after you're fasting for 36, 48 hours. This is the secret to preventing a weight loss plateau. Now, depending on where you're at in my program, if you're sitting there going, I don't have a clue how many calories I'm eating, because maybe you've been with us for 3 to 6 months and you counted your calories one time and you didn't really feel like you learned enough as far as like counting calories, then you absolutely should go on another calorie counting experiment. Like, I've never described it to you guys recently, at least that way. You've heard me talk about calorie counting intuition or kind of calorie consciousness. One ability of that should be for you, when asked, hey, how many calories do you think you're averaging? You should be able to spit off some semi-accurate number, like just some within 500 to 800 calories. Like that to me is what I mean by being calorie conscious, by having that intuition that you've learned. If you've never counted calories, then yeah, your ability to guess would be wildly inaccurate, but your accuracy should improve dramatically from doing that. And it might not take just one round of counting calories. This might be something that you need to do a couple different times. You might need to take a couple different times in your program here and spend a couple of weeks redoing it, counting again, till you get to a point where you're comfortable that, hey, without counting, I can just make an honest guess. That's a very valuable tool that aids to the sustainability long term. So with that ability, you can comfortably say, bringing it back to what we're talking about, preventing the plateau, we want to make sure we're reasonably somewhere in that TEE range outside of that long fast, so that we get all the benefit of the fast, we become insulin sensitive, we get all that, we lose all our fat for the week, but then we create that opposite signal, which is non-starvation. Your body's feeling really good, it's liking all those calories, and then you just keep repeating that cycle week by week.